everyone, I am Dr. Radhika Torgal, Cornea, Cataract and Refractive Consultant in Shekar Eye Hospital, Bangalore. Today I am here to talk about corneal transplant and what the patient should expect out of the procedure and what the patient should understand regarding the procedure. So to begin with, let us understand what is corneal transplant and in which part of the eye it is done. So if this is the side view of the eye and this is the most front portion of the eye called as cornea, it is the black structure which is seen, but is actually transparent and forms the most front portion of the eye. Okay, so this is the part called as cornea. And corneal transplant means replacing the cornea, the deceased cornea, with a healthy one. Either a part of it or the whole thickness of the cornea is replaced. So coming to the types of corneal transplant, the cornea itself is a spherical structure like this, and it has 5 layers in it. So depending on the type of the disease, either the front few layers are replaced, or the most behind layer of the cornea is replaced, or the full thickness. If the whole cornea is diseased, then the whole full thickness of the cornea is replaced with a donor cornea which is received from a deceased person. So that cornea transplant, either of the 3 situations, it can be done. So technically speaking, if only the most front portion, the front layers are replaced, it is called as deep anterior lamellar keratoplasty. If only the behind layer, that is a posterior layer, is replaced, it is called as a Descemet membrane keratoplasty, endothelial keratoplasty, or Descemet stripping endothelial keratoplasty. And if the whole thickness of the cornea is replaced, it is called as penetrating keratoplasty. So now coming to the indications or diseases in which cornea transplant is indicated. So here there can be situations where there is a spot on the cornea due to trauma or infection. In that situation, if only the superficial layers of the cornea are affected, that is the 1/3 or 2/3 of the cornea is affected, then the type of keratoplasty called as deep anterior lamellar keratoplasty can be done. Or next is when the most behind layer of the cornea, that is the endothelium, is not healthy and it is not able to maintain the transparency of the cornea, then either Descemet membrane or Descemet stripping endothelial keratoplasty can be done. The third situation arises when the whole of the cornea is either opacified or whitened due to a disease, then the whole full thickness of the cornea can be replaced, and that is called as corneal transplant. Now, after understanding what are the different types of corneal transplant, now arises the question what has to be done and how it has to be planned. A person who has a disease of the cornea should meet a cornea specialist who is a doctor who specializes in this layer and take opinion from him or her, and the doctor will evaluate the eye in terms of how is the cornea, which type of procedure it is suitable for, and how is the health of the nerve of the eye, and then decide what is suitable for the patient. Cornea transplant replaces the front layer of the eye, but it is also important to assess whether the retina or the nerve of the eye is functional, so that after cornea transplant, it is able to yield useful vision. So once the necessary tests and evaluation has been done and the patient is found to be suitable for a particular type of transplant, then the patient is registered in a recipient list where it is noted down that this patient requires this particular type of transplant, and a suitable donor, whenever it is available, the patient is informed about it and the surgery can be performed. In a cornea transplant, the deceased cornea is replaced and cornea is received from a donor cornea from a deceased person. Means a person who dies would have donated his or her relatives would have donated the cornea, and within 6 hours of death the donor is retrieved and it is preserved in suitable media, and which can be used at a later date within a few days onto the deceased person eye, and in that way corneal transplant can be performed. Regarding the procedure itself or the surgery proper, in full thickness and anterior lamellar keratoplasty, stitches would be required on the cornea, whereas in the endothelial graft or the most behind layer graft, stitches may or may not be required. And cornea transplant is a procedure in which some follow-up will be required after surgery, like day 1, day 7, and maybe after 1 or 2 weeks of surgery, and then monthly for 1 year or 2 years the follow-up will be required, and some long-term medications also will be required to maintain the health of the cornea. So it is also important to understand what should be the patient expectation after surgery. Yes, the first thing is some follow-up will be required. It will definitely replace the deceased cornea, and a healthy cornea will be stitched to the recipient cornea. But yes, the vision will not be as comparable as a normal individual. It will be less, but definitely better than when it was with the deceased cornea. Also, one should understand what are the treatment modes and what are the complications or the prognosis associated with the surgery. Complications like increased eye pressure or graft failure or rejection is a possibility, which yes, it is a remote possibility, but yes, it is definitely a probability that one patient should understand. So with all this, I would like to conclude telling that if a patient has a disease in the cornea which requires cornea transplant, it is better to consult a cornea specialist and take opinion and follow their advice. Also, I hope this video was useful to you all.